To Sugar Talk with Dr. KG and Lucas, and Dr. Lucas is here in the studio with us. Good morning, Doctor. How are you?
Good morning, I'm good.
What are we talking about today?
We're talking about all our studies that we have.
Okay, your study. Well, you recently, in the last year, changed your name. This kind of reflects because you do a lot of studies.
Well, and we're also moving into other fields and getting other doctors in the community to help out with the different studies. So we're not just doing diabetes studies. We're trying to branch out into other disciplines. So that's why we want to talk about what studies we do, because we're not just for diabetes studies.
So, and you bring in some other medical practitioners to go along with that.
Right.
Okay,
So we have
cool.
family practice, and we have GI and hematology, and we're probably getting the dermatologist to help us with some dermatology studies. So that's sort of real interesting.
Okay, all right. So what sort of studies are you recruiting for now?
So we'll go back to the diabetes studies first, because that's where we started off. We have 2 type 1 diabetes studies, and one of them is an oral agent for type 1, which is unusual to have a pill that helps type 1, but it helps the insulin work at the cellular level. So it's not, the pancreas can't make any insulin. It's not to give you insulin, but it's to help your own insulin work better, work quicker, so that you don't need as much insulin. So they're looking for people that are already on insulin pumps and who are on continuous glucose monitors. So that's sort of a special group, because they want to keep them on the glucose monitors. They'll switch it to a Dexcom monitor, which is a continuous glucose monitor, during the study, and provide the sensors during the study. So that's
is that one of those scan type?
Yeah,
sensors?
there's one that's well, they have the Libra, the Freestyle Libra, which is that one you wear on your arm, and you just wave your magic meter over it, and you can see what your blood sugar's been for the last 8 hours, or you can see what your blood sugar is right that minute. The other ones are Dexcom monitors, which you wear under your skin as well, but it sends a continuous readout to your cell phone.
Oh, okay.
So you can just look at your phone all day long and see what your blood sugar is. Or if you have an Apple Watch, you can look at your Apple Watch and see what your blood sugars are.
You know, over the years, anybody who's watched any athletics, especially it seems like basketball is where you see it, you have people with type 1 diabetes that play at a high level, but they've got to monitor all the time.
Oh yeah, I mean, you almost have to, because you don't know when your sugar's going to drop when you're exercising, and you don't know when you should eat, or so that's very helpful for that. Because sometimes the blood sugar doesn't drop while you're exercising; it drops 12 hours later, 18 hours later, when your muscles replenish, the sugar is used up. So that's very helpful for athletes.
So these are you're recruiting for type 1 people.
Yeah, there's one for an oral agent, and there's one for that's coming up that has a pump with 2 types, not only insulin but glucagon, which counteracts insulin. So it has a sensor with it, measures your blood sugar. If you're low, it gives you a little glucagon to make your liver release sugar, and if you're too high, it gives you insulin. So it's more like an artificial pancreas would be, and that's coming up probably in the fall.
Oh wow!
So that's one of the future studies that we have.
Now, what are the parameters of somebody with type 1?
They haven't told us yet, but probably it's anybody with type 1, whether they're on shots or pump, that they'll put them on the pump. So it just depends on, what their sugar range is. They don't really care if it's low, the sugar's too low, because this pump is supposed to even out their blood sugars and make it not go too low.
I haven't heard about that element that you're talking about before, the releases to have the liver produce more or release sugar.
Yeah, glucagon is made by the pancreas as well, and a lot of people with type 1 also don't make glucagon, because your islet cells make glucagon. So this will be replacing 2 hormones instead of just the insulin, which is interesting to do, because hopefully the sensor is so good that it won't give you false readings and you squirting glucagon and your sugar goes real high. But I guess that's what they're trying to find out. They're trying to perfect it, so it's not just insulin that's important, it's the other hormones too.
Well, it's any kind of technology-based treatment. You've got to make sure that the readings are good.
Right, and the sensor is not in the bloodstream. The sensor is under the skin, and there's a lag between the blood sugar in the bloodstream and the sugar that's reading under the skin, but you calibrate it based on your finger sticks, so you can sort of see how it relates. So that's the type 1 studies. So those are really interesting. Type 2 studies, there's a metformin only, and you add another agent that makes you more sensitive to insulin. So that's another pill, and it's for people on metformin only who are not perfectly controlled. So their A1C needs to be 7 or more
Mm-hmm.
for that one. There's another one that's an oral insulin. I think we talked about that before, that you can be on 1 to 3 oral agents, and they would add this on top because the next step would be insulin, usually with people not controlled on 3 pills or 1 pill or 2 pills. So that's going to restart recruiting next week. Then there's a high-dose Trulicity study. Trulicity is a weekly shot, sort of like Victoza, but it's once a week. And they're trying to raise the dose to see if it would help weight loss better. So people on metformin only who've never been on any shots for diabetes would be good candidates for this one. And they raise the dose. Everybody gets Trulicity, so that's a good thing. But then some people get a higher dose than others, and you won't know which dose you're getting. You'll pretend to go up. Some groups will pretend to go up on the dose, but they really don't. And other groups will, so we'll see how that works out.
Okay,
But that's
part
very
of having
interesting.
a control group.
Yeah.
Okay.
So then there's people that are at risk for heart disease or that have heart disease, and there's a weekly shot for that as well as a pill. So there's 2 long-term, these are long-term studies for type 2, and they have different criteria for those. But usually people with diabetes are at risk for heart disease anyway because they have diabetes, high blood pressure, high cholesterol. So those are usually the ones that get them in the studies. And then another one is whether you have kidney disease or not, but that's part of that. So that's the type 2 studies. And then we have cholesterol and triglyceride studies. So when I made a list of all these studies, I'm like, whoa, look at this. We got a lot of things going on.
But those are the basic diabetes ones.
Those are the diabetes ones.
Okay.
And then after that, now people with diabetes have these other things too.
Right.
So that you can have diabetes for these other studies,
kind of how you
but
got
you don't
there.
have to.
That's how you got
Yeah,
there.
diabetes has, people with diabetes have a lot of things going on with their medical problems, so they usually qualify for a lot of different studies, not just diabetes studies. The high triglyceride studies, we have a statin intolerance, the high cholesterol that you can't take statins because your muscles hurt. So that would be like, Lipitor, Zocor, Pravachol, Pravastatin, Torvastatin, Simvastatin, Rosuvastatin, all the statins. If you can't take those, if you can't take 2 of them, and you have a risk factors for heart disease, or you have diabetes, you can qualify for that. There's also another one for people without any heart disease that have high cholesterol and diabetes.
Oh, okay.
So those are the same. That's the same cholesterol medicine. They're just doing it with a different group of people.
Okay.
There's the testosterone study, which uses androgel, and it's for people at risk for heart disease, or it's another long-term cardiovascular outcome study for male hormone to prove that male hormone doesn't cause heart attacks,
Okay. All right.
which is ridiculous.
All right.
Anyway,
Let's take a short break. We'll come back with some more of these as well too, and also tell you how you might want to qualify for these or sign up for them as well. With Lucas Research, go to lucasresearch.org or call 222-5700 for an appointment. We'll have more with Dr. Lucas in just a minute. Hey, welcome back here to Sugar Talk with Dr. KG and Lucas here on the Talk Station, FM 107 and AM 1240. We're looking at all the different studies going on through Lucas Research now, and all the different disciplines you're involved in now. So why this change, by the way, to just increase the studies? You find that the people are very receptive to?
Yeah, we're trying to get the community more receptive to doing studies. All our patients seem real excited about it. And there's a lot of other medications besides diabetes medications around. And we just, well, I guess once we started getting into fatty liver studies, then that was a whole nother discipline, because endocrinologists usually, even though they see people with fatty liver, they don't do much about it. It's more the gastroenterologist. So once we got into fatty liver studies, we realized that we can do, other things. Our patients have other problems, and their relatives have other problems, and people are interested in being in other studies.
Okay, so what are some of those others?
So we have gastroenterology studies, which would be like stomach and colon and disorders. We have the gastroparesis study, and that's for people with diabetes that their stomach doesn't empty properly. There's an injection for that. And then uncontrolled inflammatory bowel disease, and that would be like ulcerative colitis, and we're getting a Crohn's disease study. So Crohn's disease, ulcerative colitis are in that inflammatory bowel disease category. We're looking at...
And those are autoimmune diseases.
Yeah, autoimmune diseases, and it's an immunomodulator. They're getting very specific with their little antibodies that attack certain parts of the immune system, and that's what a lot of these studies are. Just like psoriasis, rheumatoid arthritis, and inflammatory bowel disease, they're using the same drugs, for all of those because they're all related to the immune system.
Okay.
So if they can find the perfect one for that, even asthma and eczema,
Wow.
which is atopic dermatitis.
Okay, next diabetes school is coming up at the aquarium in October, but you can go ahead and get online and get qualified for a research study or sign up for that next diabetes school as well too. Go to lucasresearch.org, call 222-5700. Thanks, doctor. See you next
Thanks.
time.